Good afternoon and welcome. My name is Lucy Aquino and I'm the Chief Executive Officer of Hispanocare, Inc., a program of Advocate Illinois Masonic Hospital. And today you are watching a live interactive call-in show, and the number's at the bottom of your screen. During the next 25 minutes, we're going to be discussing this topic that everyone's talking about: affordable health care reform. What does that mean to you? So we invite you to call in with your questions at area code 312-738-1060, and our lines are now open. Joining me today is Tamatha Smith, Community Relations Specialist with Blue Cross and Blue Shield of Illinois. Allow me to introduce you to Tamatha. Ms. Smith, thank you so much for being with us today.
Thank you for having me today, Lucy.
Really do appreciate you being here.
Thank you.
You know, there is just so much going on with healthcare reform. There is so much confusion as to what's happening. Lots of questions are being asked. And even though answers are being given, but they're very confusing answers.
Right.
And not everyone knows what's going on. So I really want to ask you, Tamatha, the new healthcare law, exactly what is it? What does that mean?
The new healthcare law is actually called the Affordable Care Act, and it was signed into law in March of 2010. And the purpose of the Affordable Care Act really is to make health insurance more affordable and more accessible to those who want to purchase it and those who are currently uninsured. Some of the changes that the law is going to provide have already taken place, such as adult children can stay on their parents' policies now until age 26.
Which is a really big deal.
Yes, it is.
Right.
Many of our young adults go uninsured simply because they, at one point, had to be in a university, for example, to get coverage, or perhaps they've aged off their parents' policies. Other aspects of the law are going to be phased in over time, and many of them taking effect January 1st of 2014.
Okay, so that really brings us to, you know, the new healthcare law. So Tamatha, if I'm asking you, Tamatha, that I'm this newcomer to this new excitement, I'm going to have health coverage now. What does that really mean to me? I mean, how is that law going to really help me? I mean, we're all insured, we're all going to be insured, but what does that really mean legally? I mean, what does that mean?
Well, no, it's a really good question. First and foremost, many people just simply weren't able to afford health insurance coverage. So the law has put in place a way that people can get assistance with paying for their health insurance, either through some tax credits or through subsidies that will help them pay their premiums, pay their co-pays, and pay deductibles depending upon where their income levels fall.
And that's a good response, because the two key words in that sentence that you just mentioned were subsidies and tax credits. Can we talk a little bit about that?
Sure.
What is a subsidy?
Subsidies are actually assistance that people will get based upon where their income level falls. They will be helped with making payments such as deductibles and co-pays, which often are a part of a health insurance policy. Tax credits, what the Affordable Care Act has also done is created a way for individuals to get assistance through their tax credits, meaning that, again, depending upon where they fall income-wise, they may get assistance with paying for their premiums through their tax credits. They can take that up front, meaning that they can actually have the government make some of the payment on their behalf to the insurance company to help them pay for their plan, or they can actually get this on the back end when they go to do their taxes. Again, they just show what they have paid for their health insurance, and they can get some of that money back. Now, it may not be 100%, but many individuals will be able to qualify for some sort of assistance.
Okay, so really then, I'd like to mention, and correct me if I'm wrong, you're the expert here, so correct me if I'm wrong. So some of the top 5 things that our viewers, in this case, our viewers should know about the Affordable Care Act is that you must get insurance starting 2014. That's a must, right?
Exactly. There has actually been a mandate put in place, meaning that those who can afford to purchase health insurance should purchase a health insurance plan and keep that coverage. Those who are also without insurance but can't afford it may be able to get assistance through a government program such as Medicaid.
Okay. So you can get insurance even if you're able to enroll in some form of insurance coverage, regardless of your age, gender, or health status, that otherwise you may have not before been able to obtain coverage.
Exactly. One of the new aspects of the law is that everyone will be able to get health insurance coverage, meaning that guaranteed coverage will be available. In the past, many people were able to afford health insurance coverage, but may not have been able to receive it because they had some sort of pre-existing condition that kept them from getting covered. Well, what the Affordable Care right. What the Affordable Care Act has done has actually said everyone will be guaranteed coverage. So pre-existing conditions won't necessarily keep someone from getting health insurance.
So you can no longer be turned down.
Right, because of a pre-existing condition,
Right.
correct.
Now, the insurance, even if you have a pre-existing condition, you'll be eligible come January 1 of 2014.
Exactly.
And to remind our viewers that even children up to the age of 26, you can now carry them on your plan.
Exactly.
Correct?
Yeah, right. The law did put in place young adults can still be carried on their parents' policies until age 26. They don't have to live in the home. They don't have to be enrolled in school. They don't have to be, they can be married and still be covered, but for that child only, for that young adult only, not the spouse.
Okay. Well, that's good to know. You have a lot of that going on out there where you do have the younger youth who are getting married younger and do get married, who do have families, but then are uninsured. And it's better to have something to have nothing at all.
Exactly.
I mean, even if it's just for a short period of time after you're married and out of the house or whatever. That being said, I want to remind our viewers that my name is Lucy Aquino, and I am the Director of Community Health and Education and CEO of Hispanocare with Advocate Illinois Masonic Medical Center. And joining me today is Tamatha Smith, Community Relations Specialist with Blue Cross and Blue Shield of Illinois. And today's topic is Affordable Care Act and open enrollment, which is around the corner, October 1.
20 days away.
And we do. So we do, Tamatha, have a caller. Caller, you're on the air.
Yeah, good evening.
Good evening.
I wanted to ask your guest, pose a hypothetical question to her. Let's say someone did have a pre-existing condition. Have they already established maximum out-of-pocket amounts for people, a stop-loss amount where that person could calculate, what would be the maximum they would have to pay in 1 year's time out of their own pocket if they had frequent visits to a doctor?
Thank you for your question, first and foremost. And yes, many of the plans will function a lot like insurance functions today. Many of them have out-of-pocket maxes. Some people call them MOOP. You may hear the term MOOP used. Out-of-pocket maxes simply means there is a stopping point for co-pays, deductibles, co-insurances, in which the individual will have to pay out of their pocket. Usually this is an annual dollar amount. And after the individual has reached this point, then the policy will cover the rest of the costs at that point. So yes, many of the plans will have out-of-pocket maxes.
Okay.
Many of the plans right now are still in the process of being approved.
Okay.
So do I know what those are at this time? No, I do not.
No.
But come October the 1st, you can definitely go to the new established health insurance marketplaces and take a look at all of the different plans and compare those plans, and you can see what each of those plans have in terms of their out-of-pocket maxes, and you can choose the plan that works best for you based on that.
Oh, thank you for that. And I know that question's being asked a lot, and I'm glad our caller called it in because fantastic answer. And obviously those are things that we have to research. We have to look and see what benefits, because they do differ from one plan to another.
They do.
They do differ. So we have to compare apples and oranges and see what's what and what's a better benefit, especially for those individuals too on Medicare A, B, and D, and all the other letters that they have going on with those. So it's really, really important that we do compare what the benefits are and what you're getting for your money and your investment. And it is a big investment in healthcare, and you want to get the best possible coverage you can. What, Tamatha, if I cannot afford health care, what can I do? What can we expect to see?
Well, first and foremost, one of the things that the Affordable Care Act has done is to allow states to expand their Medicaid program. So some states have decided to participate and expand the Medicare program, which means more people will be able to qualify for Medicaid. So you always
Whereas before they may have not been able to.
Exactly. So you always have that person, and we would hear the stories all the time that, I was just this far from qualifying for
Just
Medicaid.
made a little bit too much money.
Yeah, exactly.
Right.
So starting in 2014, they probably will have a better chance of qualifying.
Right.
Also, you can expect to see more choices on the health insurance marketplaces starting in 2014. So an individual will be able to go online or call on the phone and be able to compare the different plans and what their different options are and pick a plan based on what their needs are and what their budget can afford for them, as well as the new tax credits that will be available for those who qualify based on their
Now, I know that open enrollment starts October 1, and I understand that it has been extended through March.
Yes.
Now, can you talk a little bit about, Tamatha, the October 1 enrollment? Obviously, you enroll from October through December. You're effective January 1.
Exactly.
What happens to those individuals who choose to enroll February and March, for example?
Well, the initial enrollment period for the Affordable Care Act will start October the 1st and will run all the way through March 31st of 2014, so 2014. Those who sign up for their plans by December 15th, they can have their coverage start as soon as January the 1st of 2014. So none of the plans are actually going to start prior to January the 1st of 2014, but you are able to start enrolling starting on October the 1st. Now, those individuals who might enroll, say, end of January, February, depending upon when they enroll, their plan will start based on their enrollment time. But they have until March the 31st.
Okay, so if they enroll, let's say, February 1, they probably won't be effective until March 1st?
Exactly.
Okay, so a 30-day leeway.
The following month, I do believe.
So regardless of when they enroll in the month?
That I'm not exactly sure about, but standard is usually within the start of the next month.
Okay. So, Tamatha, if I don't qualify for a government program, but still can't get affordable insurance, what happens if I don't qualify?
Again, individuals who may not qualify for a government program like Medicaid or on the other side, Medicare, can also be eligible still for tax credits or subsidies. Again, it's going to be based on the individual's income level.
Are they using then your tax return from the previous year to determine income level?
Exactly. What's going to happen when people go to enroll in these plans, they all have to go through the health insurance marketplace. So there is actually a website. Most of this is going to be web-driven. Those who do not have web access can actually call the health insurance marketplace and get the same information and the same assistance with enrolling. Their phone number in case it is needed.
As a matter of fact, let me provide this number too. With Blue Cross and Blue Shield, anyway, there is a toll-free number, 1-888-809-2810, or you can visit www.bcbsil.com. And that's www.bluecrossblueshield.com. By getting that, I know that some of these sites, and I think including Blue Crosses and Blue Shields, has an actual calculator. You can calculate everything out pretty much.
We will have a calculator, a subsidy calculator on our website starting October the 1st.
Okay.
There are also many subsidy calculators out there at various different websites. I think everyone has jumped on board to try and help people figure out how much they would possibly be eligible for in terms of tax credits. The subsidy calculators will ask you certain things. It will ask you about your income level, because that is actually what's going to be used to determine someone's eligibility. It would also ask you how many people are going to be covered by this particular plan. It's also going to ask you what areas you live in, so whether you're rural or whether you're more metro. And that does make a difference. Typically insurance costs a little bit more when you're in a more heavily populated area than it does more rural areas. So does everything else, I think. But
you're paying more. You're paying more for access, easy access.
And whether or not you currently have an employer coverage. So based upon how you answer those questions, the insurance marketplace is going to spit back out to you, or the calculator that you use should spit back out to you approximately what you're going to be eligible for in terms of tax credits or subsidies. Or if you may qualify for a government program such as Medicaid. Depending upon the subsidy calculator that you are engaged in, that's going to determine what type of answer that you get in return.
And that could also tell you then whether or not you qualify for Medicaid? Would that be able to do that?
Yes, my understanding is that many of the subsidy calculators will tell you that you may qualify for Medicaid assistance. It's also my understanding that the health insurance marketplace calculator will indeed tell you if you do qualify for a Medicaid program, but you still will be encouraged to go through the application process with Medicaid.
Now, I know, Tamatha, that throughout this process, starting October 1st, throughout the city, well, actually just about everywhere, you'll have navigators that'll go out and help enroll you into these plans and give you more information on what these plans consist of. Is that correct?
Navigators will be available in different places. Their job really is to help educate people about what the Affordable Care Act is all about, educate them on how to navigate through the websites, help them with determining what they need to do to help pick a plan that works for them.
And for those individuals who are not computer savvy or don't have access to the internet, there'll also be all kinds of community organizations that will be providing that assistance as well to help you enroll. And there'll be places everywhere, from hospitals to libraries to churches. I mean, everyone, community centers.
Senior centers will probably have.
MCAs probably, and there's a lot of community-based organizations out there who are really getting all together and working together to make sure that everyone who needs to be enrolled, who is looking to have this type of coverage and has all these questions and needs them answered, they're going to be available throughout the city.
Exactly. And starting October 1st, we also at Blue Cross and Blue Shield, again, we'll have our website up, and it will list all of the different places that individuals can come, where we are going to have enrollment events for people who want assistance in enrolling in a plan. Also, they can go to any seminars that we have listed. They can call our toll-free number, ask us questions. We have put together an entire team of education assistants to help.
I'm really impressed with what Blue Cross has done in working with all our community organizations and working with many of our health insurance companies, because this is what we do. We provide resources and information. I'm just totally impressed with what Blue Cross and Blue Shield has really done in Illinois, putting out the information as quickly as you have. Others obviously have joined in, and that there are a lot of Humana, and there's a whole lot of them out there that are providing this type of information. But I was really impressed with how quickly you got this information out.
Thank you. I think overall the idea is to try to get people the information that they need so they can make a more informed decision. In the end, if no one knows about the programs, if no one knows what's available, then everyone loses, the sick and the healthy.
And that's what we don't want. We want to make sure that everyone who's entitled and everyone who needs this coverage and everyone who didn't have it before now has that option. They can enroll. Now, we also know that 20% of the population, at least what I'm reading, says that at least 20% of the population will still be uninsured. Can you tell us why?
Well, I have a couple of guesses to that.
Let's take a guess.
Okay,
based on what's being said.
Yeah. Just being out in the community, and talking to people over the last, I have to say, 8 months. We've been out doing educational programs, learning programs about the basics of the Affordable Care Act and fielding questions from people in the Chicagoland area. And some of what we're hearing is, well, we didn't know about it. Chances are, if they didn't know about it, their neighbors on either side may not know either.
You're absolutely right, because one of the other things that we're getting a lot on too is that individuals believe that, oh, well, I'm going to have insurance come October 1 and now I'm okay. But the reality is you have to enroll.
Yes.
It's not just going to come to you if you're uninsured. Individuals, we need to research, we need to look at, we need to know where it is that we're going to enroll. And what's available to us? What benefits are we getting? What are we paying out of pocket? And all of those things we need to find out. But if you don't enroll, you will not be covered.
And also, too, Lucy, I think another aspect of this that may keep people, a little hesitant about just kind of going out and seeing what's out there is just uncertainty. Yeah. Whenever you have something new, there's always, a bit of hesitation. To jump on board.
Right. And no one wants to be the first.
Right. But it's so important that people do understand what this is all about. It really is meant to help. The Affordable Care Act really is meant to help people get a plan, have more access to health insurance, or have more access to government programs that can help them get covered. One of the things that we would like to see, people do is to either come to a seminar or call a phone number or go to the Healthcare Marketplace website or to our website and just read a little bit. And if there's questions that they have, reach out to somebody, call, get some answers before they decide. Yeah,
and again, I just want to put this back on the TV, on monitor, so that the folks can call toll-free number at 1-888-809-2810 or visit www.bluecrossblueshieldillinois.bcbsil.com, and you can find out more about what's on the market exchange and the marketplace and all that, which is what we're hearing a lot about, the marketplace exchange. So folks need to understand, when you hear that, that totally means it's the new Healthcare Reform Act that's taking place. It's the law, right? Yeah. It's right that. So beginning October 1, they'll be able to go online and or go to a site if they don't have access to internet, which someone can help them enroll and answer all their questions for them.
Right. The Healthcare Marketplace is where people can go to actually initiate that enrollment process. Or, of course, they can always go to any insurance company's website who will be selling plans on the exchanges. Right now, I can say with confidence that Blue Cross and Blue Shield will be selling plans on the exchanges, or as we call it now, the healthcare marketplaces. Healthcare.gov is the main website for the health insurance marketplaces. They can start there. And from there, they can go through. They can compare all the plans of all the different companies who will be selling.
And it's right there. I mean, you can really compare them side to side by looking at them.
Yeah. And as a matter of fact, the plans will all have similar benefits on the marketplaces. The idea is to make it a little easier for people to pick and choose between their plans. So they will include all of the essential health benefits. So things like your doctor visits, your ER visits, newborn and maternity care, prescription
drugs, care, and all of that. Yeah. I know that our time here goes by really fast, but I want to make sure that we cover, Tamatha, that what is the penalty that we keep hearing about? If you don't sign up for health insurance by 2014, you will be penalized.
Well, part of the law, in order to make it effective, in order to make it work, it includes a individual mandate, which simply just states that individuals should all have coverage for health care or maintain their current coverage for health care. So a person can have insurance through their workplace as long as it is ACA compliant, so Affordable Care Act compliant, and your employer should be able to let you know if your plan is. Or if you qualify for a government program such as Medicaid or Medicare, you're fine. You can keep those programs as long as you qualify for them. Everyone else, though, if they do not have insurance currently, they're uninsured for whatever reason they may be. If they decide not to purchase insurance for the 2014 year, they may face a penalty.
Right.
And that penalty right now for 2014 would be $95 for an individual or 1% of the income, whichever is greater. And, many people, I've heard them say, well, they're calculating, what is that? But it's important to know that these penalties can increase every year.
Right. And that's really important. Tamatha, our time here goes by so quick, and there's just so much information that we want to share, and we just want to make sure that our viewers are out there, community is out there, taking advantage of what's available to you. But I want to thank you so much for coming out and invite you to come back because there's so much more to cover.
It is.
October 1st is really a ways away, and keep in mind, it's coming. It's going to be available October 1. So I want to thank you for being on the show today. Thank you, and Blue Cross. And on behalf of my colleagues at Hispanocare and Advocate Illinois Masonic Hospital, thank you for watching. Until next time, more information coming up, and we look forward to talking to you further about healthcare reform, preventive disease, and so much more. So until next time, tune in. Please stay. Bye-bye.